So you're living in this vortex of change and making sure that there is stabilization for the present, but also keeping an eye on what are the future trends that you need to be aware of. So I think leaders, especially people that sit in my seat, have to make sure that, we're agile, we're adaptable, that we're adroit, that we are looking at all the things that are going on right now, making sure that, we're trying to stay on top of them to the best of our ability, while also pushing the employees and pushing the organization forward and saying, hey, my turn is almost over. I'm about to hand this baton to you. So make sure to prepare yourself for taking this baton, because the race will continue.
Oh, I love that. Now, would you say it's more difficult to have your team looking more towards the future or stabilizing for the present? You mentioned both.
I think, there's so much uncertainty about the future. I think you can certainly stabilize the present. We've done a good job with that here at Harris Health System, but looking towards what the future looks like and making sure, technology is coming in very fast, and we're trying to figure out, we don't know what 6 months from now is going to look like from a technological perspective. And so having that adaptability, having that flexibility, having that, mindset of understanding, we've got to be agile enough to be aligned with things that are happening in the future is extremely important. So stabilization, we kind of reached that point. Looking towards the future, I think is probably a little more difficult.
Understood. If you could share with us what's been a recent initiative at Harris Health that you've undertaken that's had a significant impact on employee engagement and satisfaction.
Yeah, so one of the things I think we're very proud of right now is our nursing turnover. So we've done, I think some people talk about, well, what's the silver bullet that you've been able to utilize to stabilize your nursing turnover? And I'd like to say it's probably not a silver bullet, it's a silver BBs. And when I talk about silver BBs, I'm talking about there's multiple things that we've done. I think the thing that really has helped us is that this focus on our culture, making sure that we are recognizing, recognition, respect, and trust are three of the tenets of the culture that we are trying to create here at Harris Health System. And so focusing on those things, I think our compensation has been in line. I think our nursing succession has sort of worked out for us. And so putting all those things together, I think, is very important for us organizationally. But just having leaders who are engaged. We conducted our employee engagement survey last November.